Susan G. Komen releasing reports of a new study showing why Black women are more likely to die from breast cancer than white women, this despite improvements in treatment.
Yeah, and that's even more alarming. The disparities in mortality across the U.S. are among the highest in Suffolk and Chesapeake. News 3 reporter Antoinette Delbel explains how the foundation is trying to change that.
Lynn Young's family health history, painting an uncertain picture of her future.
I lost my grandmother. I never knew her because she passed when she was 35, when my mother was young. I lost my mother when I was young. My mother's two sisters also had breast cancer.
All those women dying from breast cancer, but Young breaking that cycle, now cancer-free for 16 years, a survivor and advocate.
It explains why I'm so passionate at being in a community and reaching out to others who are going through it, because it's personal to me.
Feeling dismissed when doctors first diagnosed her, she now helps Black women in particular who believe they're being treated differently because of the color of their skin.
Sometimes the doctors are not listening and not dialoguing that I hear you.
Susan G. Komen is working to close the growing breast cancer inequity gap after its study dove into why Black women are more likely to die from the disease than white women.
We're dying at 40% higher rate than white women. It's a huge disparity.
The multi-year study finding the health disparities in the Tidewater metro area are among the highest in the nation, with Suffolk and Chesapeake having the widest gap. Natasha Majay with the Komen organization says the report outlines multiple reasons, including financial and transportation issues, lack of insurance, and fear of going to the doctor. The Stand for Her initiative is meant to break down those barriers.
And now it's time for action. And that's really what Stand for Her is. Stand for Her, a health equity revolution, is really our aim is to reduce those disparities.
Komen is increasing access to services and testing, providing emotional and financial support, and updating its educational materials for the Black community. Lynn Young, hopeful it'll save lives.
And once we get over bridging that gap and learning how to trust the medical field, because we need the medical field. Too many of us are dying. It's not an African American problem, it's an everyone problem.
In Chesapeake, Antoinette Delbel, News 3.
Now, Komen's goal is to reduce the rate of death for Black women by 25%, starting right here in the Tidewater area and other 9 metro areas where the disparities are the greatest.